that is menstrual cycle. That is next class is regarding the continuation of that is ovarian hormones. That is next class is regarding menstrual cycle. It is otherwise called uterine cycle. That is, we can discuss about the menstruation. That is, the menstruation refers to the monthly discharge through the vagina. That is, it contains blood and other substances from the uterus in non-pregnant adult females. This is menstruation. Average length of the cycle is 28 days. This occurs during puberty till menopause, except during pregnancy. Then menstrual cycle occurs in 4 phases. Then first phase is early proliferative phase. Second one is late proliferative phase. Then during this late proliferative phase, this endometrium forms the basal layer, functional layer, spongy layer. That is, these 3 layers have distinctive characteristics changes. Then next one is secretory phase. Then last one is premenstrual phase. These are the 4 phases of menstrual cycle. Then we can discuss about the early proliferative phase. This follows menstruation and lasts up to 9 days. Average duration is 5 to 9 days. During this period, this endometrium is less than 2 centimeter thickness. The glands are narrow and straight. Blood vessels are numerous and prominent. It is under the control of estrogen. Regrowth and thickening of the endometrium begins. This is the early proliferative phase. Then next is late proliferative phase. This stage contains up to 14 days until ovulation. During this phase, endometrium will be more thicker and forms 3 layers. Then first one is basal layer, that is seen immediately above the myometrium, about 1 mm in thickness. This layer have no changes during menstrual cycle. It consists of rudimentary structures to build up the new endometrium. Then next one is functional layer. That is, it contains tubular glands of 2.5 mm in thickness. Tubular glands of 2.5 mm in thickness. Then next one is spongy layer. That is, a spongy layer, it has a cuboidal ciliated epithelium covers the functional layer. This is the spongy layer. Then these are the 3 layers of the late proliferative stage. During this stage, endometrium has distinctive changes. Then next phase is secretory phase. Secretory phase follows ovulation and is under the influence of progesterone and estrogen. The phase lasts up to 26 days. The functional layer thickens to 3.5 mm and spongy in appearance. Endometrium is more vascular and rich in glycogen. Then spiral and coiled arteries develops and become torches. This is the secretory phase. These are the distinctive changes which occurs in the endometrium during the secretory phase. Then last one is premenstrual phase. Mensisinu munpe ulla a phase aanu, that is the premenstrual phase. During this period, regression of the corpus luteum occurs and there will be decrease in the level of the ovarian hormones. This phase lasts from day 27 to 28. This is the premenstrual phase. That is, we have already discussed what is menstruation. That is, menstrual cycle has 4 phases. Early proliferative phase, late proliferative phase, that is during the late proliferative phase, that is endometrium forms basal layer, functional layer and spongy layer. And the next one is secretory phase. These are the four phases of menstrual cycle or uterine cycle. Then next is menstrual phase. That is menses that is characterized by vaginal bleeding, last for 3 to 5 days. In this, this is the last phase of menstrual cycle. The endometrium shed up to the basal layer along with the blood from capillaries, and also the unfertilized ovum. Also it is a shed during the menstrual phase. Then along with the, that is the last period is lastly that is the bleeding stops. Then next one is menarche. That is the first menstruation, usually at the age of 12 to 13 days. That is menarche means, that is menarche definition is the first menstruation usually at the age of 12 to 13 years. Then next one is puberty. That is puberty refers to the period in life during which the reproductive organs develop and reach maturity. This is the period during which the reproductive organs develop and reach maturity. Then menopause is the cessation of menses.